As someone who had a couple of brain injuries, and none of my symptoms were seen, the invisible ones, the unseen symptoms, my God, I still feel them, and they're incredibly confusing things that people feel on a day-to-day basis, regardless of brain injury. So it's so hard to quantify as the patient, what is the brain injury doing it, and what is life, stress, work, heartache, sleep, all of those things, and how they're translating in terms of your brain injury recovery. And I know I felt very ashamed to admit that I felt those things, and I felt like there's something wrong with me. That, you know, you've survived a brain injury, surely everyone said you're good to go, so off you go. And if you've got any repercussions, thank you lucky stars that you are, you know, here. And I'm guessing that there's a lot of people who are probably in a similar boat, and then having those on top of having physical repercussions as well is obviously an even greater thing to try and get your head around. But how do you treat them? How do you better understand them, or how do you empower your patients to understanding and managing them?
Well, if you're talking about the invisible symptoms, then the important thing is to recognise them, and that's probably one of the things that we don't do so well. So in general, thinking about how you treat brain injury, we're quite good at the acute phase. So in other words, the first few hours or days after stroke or brain injury, we've got hyperacute stroke centres, we've got trauma centres, so we're pretty good at that. But it's the recovery bit that we're failing at. So patients often find that the treatment that they're receiving, and by treatment we're talking about what I call behavioural interventions, things that are delivered by physiotherapists, occupational therapists, neuropsychologists, speech and language therapists, for example, those tend to drop off weeks or a few months after patients are discharged home from hospital, whether they're continuing to improve or not. And that really contributes to a sense of abandonment. If you talk to patients, it's quite common for them to feel abandoned after they've left the hospital. And that's a combination of the fact that they maybe feel that they can continue to improve, or they don't know what their prognosis is, but it's also mixed in with these invisible symptoms that they're also experiencing, which maybe their clinicians who are looking after them haven't noticed, but also their family members can't see as well. So that kind of creates a barrier between them and family as well.
Absolutely. It's really, yeah, abandoned is a very good word for this, I think, and a complete loss of hope, because it's incredibly confusing. I still find it incredibly confusing, and there's a part of you that feels so grateful, and there's a huge part of you that feels so grateful and lucky to be alive and to have survived it, and to have survived those really, for most people, incredibly traumatic weeks in hospital when you've just had it. And then you walk out and you go, so that's it, right? And if someone were to stop and say, actually, there's a few nuanced things that you're probably going to be dealing with later on down the line, you almost don't want to think about it. You're like, but I'm here, so I should just do these things, and then you ignore those invisible symptoms, which is why you're so rightly saying acknowledging them and recognizing them is kind of step one.